Hello everyone, I would like to welcome you very much to the Food Packaging Forum webinar on food additives and child health. Our guest speaker today is Professor Leo Tresande, and he will be speaking about food additives and child health, a review of the technical report and policy statement from the American Academy of Pediatrics. And I will introduce Leo in more detail in a second. I would just like to take this opportunity to present Food Packaging Forum. Very briefly, we're a charitable foundation established 6 years ago based in Zurich. Our work focuses on science communication, on chemicals in all types of food contact materials and articles. We're interested in how the chemical components of these food contact articles transfer into food and what the health outcomes are of this chronic exposure. We also focus on the current science from an interdisciplinary perspective. Our products include a free newsletter, which you can subscribe to by email. It's published twice a month. We have different dossiers. We have webinars. This one here, we have an annual workshop. We publish peer-reviewed articles and so a lot of background information for you if you're interested on the food contact. And to support our independent work, we always welcome donations, which are made to our foundation. So if you're able to support our work and interested, do so then contact me. Okay, so I would like to introduce our speaker today. Professor Leo Tresande is the Jim V. Hendricks Associate Professor of Pediatrics. He's also the Vice Chair for Pediatrics and Director of the Division of Environmental Pediatrics and Associate Professor of Environmental Medicine and Population Health at the New York City School of Medicine. So a lot of hats that you're wearing, Leo. Welcome, and thank you so much for taking the time to speak today. I also would like to mention that Leo has been a member of the Food Packaging Forum Scientific Advisory Board for the last 2 years. Very greatly appreciate your contribution to our work and pleasure to participate. So, as I hand the floor over to Leo, I just want to communicate the housekeeping rules. So Leo will speak for about 20 minutes, and after his talk there will be time to answer questions. So if you have any questions, you can email those to events@fp-forum.org. That's events@fp-forum.org. I have muted all participants in this call, so please make use of the email to send us your questions or also comments if you have any. Greatly appreciate the comments. And now I'd like to give the floor to Leo, and I will pull up your slides here, and then you can just click at the top of the screen to take over as present, or you can also tell me if you want to advance the slide. Over to you, Leo.
Great. Can you hear me okay?
Yes, fine.
Great. It's an honor to be here with you today and to be speaking to you about this very exciting work, which is a product of 3 years of activity by the American Academy of Pediatrics and its Council on Environmental Health. Though maybe I should start by introducing the Academy's the mission and the broader perspective of what the Academy is. But before I do that, I'd like to thank my co-authors, my lead co-authors on this document, Sheila Sathiana-Rihanna and Rachel Schaefer of the University of Washington, whose support was crucial in the success of putting together such a document and navigating a very careful and complex process that the Academy uses to vet these kinds of documents. So first, just some perspective of what the American Academy of Pediatrics is. It's an organization of 60,000 pediatricians of all swaths, specialists, generalists, and various demographic and political orientations. I'm reminded constantly in the context of very active debates on other policy issues of the day, such as in the United States gun control, that there are even gun-owning pediatricians, and I'm not suggesting that gun ownership is a left or a right issue, but I want to just give the flavor of the diversity of perspectives that comprise this large organization, speaking to the gravity and sincerity of which a large organization can speak when it is all united behind a statement. Ultimately, what all 67,000 pediatricians are committed to, as this slide describes, is the overall well-being of children all across the early life course. And in particular, our Council on Environmental Health has been the home for Academy members interested and concerned about children's environmental health and exposures that are adverse or early development in particular. Just to provide some context, there is a board of directors among other councils and committees that advise various issues from nutrition to behavior and development and a host of issues, infectious diseases. And our Council on Environmental Health is tasked with advising the American Academy of Pediatrics Board of Directors on issues, as you can see, pertaining to environmental health. This of late has included landmark documents on lead screening, pesticides, and advice about organic food, secondhand smoke, just to name a few. And a major component of the Academy's work is not only publishing policy statements and technical reports, and I'll explain their role in just a moment, but we publish a landmark book, almost the textbook of environmental pediatrics. I'd argue there's one other for the more specialist group by Landrigan and Etzel, but essentially what we call the Green Book, in contrast to the Red Book, which is the infectious disease text of the Academy, is now in its third edition. So in the next slide, I'll just present here the cover of the technical report and policy statement, and allow me to explain what these documents do. Without a policy statement, the Academy as an organization, as a non-governmental organization, is in an interesting open perspective and often does very little with regard to child health issues of the day. The policy statements that the Academy publishes and renews every 3 to 6 years, depending upon the scope of the document. The purpose is to guide the Legislative Affairs Office in Washington, as well as advising state and local governmental agencies across the country, as well as in the global context with regard to various issues and topics of the day. And on reviewing the scope and breadth of the documents that had been developed previously, there were potentials for overlap in science and content, insofar as many chemicals intentionally added to foods, insofar as you consider the agricultural process for the entire life cycle of food, have already been covered in previous statements, insofar as certain pesticides have been added to agriculture and incorporated that way. There are naturally derived chemicals that are major contaminants in food, such as arsenic, not to mention thyroid disruptors such as perchlorate, that have received attention in previous Academy statements. The idea of this document was to complete the coverage of chemical contaminants in foods, with focus not just on chemicals intentionally added to food as for any range of uses, from flavorings to also unintentionally added chemicals that are contaminated as part of the manufacturing process, those including food packaging materials, food contact materials, phthalates, bisphenols, and the gamut, and I'll go into greater detail in just a minute. The policy statement is grounded in the science of a technical report. So when there are new review policy statements to be produced and described. Seldom does one publish a policy statement alone. The technical report is meant to provide the scientific foundation and back matter to support policy statements that are not as carefully and heavily cited in the same way as the technical report is meant to serve. And these documents, when they go through first the council process, they go through what I call pan-council review, pan-council or committee review. Any council or committee that has potential contact, overlap scientifically, even on the periphery, vets these documents. We have a very active legal affairs working group that thinks about medical legal issues at the Academy. They reviewed this document and provided editing input. The nutrition, the Committee on Nutrition of the Academy provided careful input, and we had some thought exchanges every process of ironing out the document. And so it speaks to the thought that goes into place even once a document is approved on the first draft by the council. It goes through a series of processes across the committees and councils, and then goes to the board, where there is yet another layer before publication is pursued with not peer review. Their consideration is that peer review has already been done by the Academy leadership at that point, but it's publication in the end in the Journal of the American Academy of Pediatrics, which is called Pediatrics. So moving on to the next slide, having provided that background, the goal of the technical report was to review the evidence regarding food additives and their potential harm to child health, looking at epidemiological and toxicological data. And as you can see here, we distinguished up front between indirect food additives, food contact materials, adhesives, coatings, plastics, paperboard, etc., as opposed to directly added food additives. Those that are deliberately included, be they colorings, flavorings, and others. This slide provides some of the context for the report that really crystallized the need to put this report together. Though I anticipate the Academy will have a later report on endocrine disrupting chemicals, given the breadth that they cover, not just in the food additives context. Much of the food additives report and the advances of the science that really crystallized this issue were grounded in understanding that at low levels of exposure, synthetic chemicals found in foods can interfere with hormonal systems that are crucial for development. This slide provides a basic framework for the definition. There are multiple, they're diverse. There's some debate about what the exact definition of an endocrine disruptor is, but in its simplest form, it disrupts hormonal function, and that hormonal disruption of function has impact on phenotype, especially early in development. So we'll go on to the next slide. As background, the Endocrine Society has published now a number of scientific statements. This slide just depicts the 2009 scientific statement that was arguably a landmark, a watershed moment in our scientific understanding, really put this issue to the public health fore. It was followed by the WHO UNEP scientific report in 2012. In addition, the International Federation of Gynecologists and Obstetricians published its report, I believe, in 2015, speaking to the momentum that the scientific community and medical and public health communities have all put on this scope and breadth of issues. And as we know, many of the food additives are themselves known to have endocrine activity, if not already defined as endocrine disruptors. There's clearly been substantial debate in a public forum, which is healthy and good to shine the scientific light on this issue. The WHO UNEP report was welcomed by all participant countries at SICOM, that is the UN's body for reviewing chemicals policy globally. It only noted, as you can see, a subset of industries having concerns about the state of the science. There was substantial scientific literature debate, but most, if not all, the concerns were rebutted by the report authors in a transparent dialogue. And indeed, the Endocrine Society published a scientific statement with 1,331 citations documenting even more evidence for effects of chemicals, including those found commonly in food through food additive use. This slide provides a listing of the indirect food additives that were the main focus in our report. We documented a severe concern about not only bisphenol A, which has received the most attention in the bisphenol category, but many of the bisphenol replacements, the regrettable substitution that are being introduced into food through the use of polycarbonate, plastic containers, not to mention linings of aluminum cans. With the concerns you see on the right, most consistently led by endocrine disruptions, you can see for bisphenol phthalates, as well as the perfluoroalkyl chemicals. In addition, in contrast to the use of bisphenols in harder polycarbonate plastic, phthalates are known for their concern in softer food for their incorporation for food for packaging and tubing flexibility. And the implications are not just obesogenicity, but oxidative stress, cardiovascular effects. Moving on to perfluoroalkyl chemicals, which many in the audience are likely familiar with, their use in greaseproof paper and paperboard is of concern because of their potential incorporation into food, leaving aside water contamination issues, which we've experienced in the United States as serious concerns. There are concerns about immune suppression in addition to endocrine disruption, as well as obesogenicity. And finally, though, there was overlap in this regard with perchlorate as a water contaminant in our AAP report. We did feel the need to document that it is used as an anti-static agent in food packaging and has concerns relating to thyroid disruption. Moving on to the direct food additives, we noted the use of nitrates and nitrites as preservatives and color enhancers, with the concerns also about thyroid disruption, not to mention carcinogenicity. And we noted the substantial debate in the literature about artificial food colorings. We noticed the potential for effects on neurobehavioral outcomes, though we noted the limits of the scientific evidence insofar as it presently stands. So this is less strong in terms of weight of evidence, but certainly a great concern given the broad and widespread use and the documentation of exacerbation of ADHD in affected children. So the goal of the policy statement, which pinned on the technical report, was to review where we are in the regulatory framework in the United States, and that's not in a very good place right now. Arguably, we've had progress in the Toxic Substances Control Act with its revision with respect to other chemicals that has been undermined arguably in the most recent U.S. federal administration. But leaving aside the details of the implementation of TSCA more generally, the Federal Food, Drug, and Cosmetic Act is the main regulatory framework for food additives chemicals, and it remains relatively out of date compared, especially when TSCA has just been signed into its revision by President Obama a couple of years ago. So the goal of this document is to propose reforms to the current regulatory processes. Just moving along, FDUCA was put into law in 1938. There was an amendment in 1958 that established the definition of food additives and specifically established an exemption for what's called generally recognized as safe. That is that scientists from industry can essentially vouch chemical safety without any limitation on what data are required to vouch for that, as well as relatively little space for documentation and revision of that assessment once new science comes along. There was an approval process put into place in 1997 as part of the further modernization of FDUCA called the Food and Drug Administration Modernization Act. Here's a slide that just depicts the definition of food additives. We, in essence, have gone over this in the course of the presentation, so I won't give too much focus on it, just to say that there is a regulatory definition in place. And with regard to the question whether the current regulatory system ensures food safety, our review of the literature was grounded substantially in a Pew Charitable Trust report from 2013, and subsequently that documented the lack of testing of food additives, with only 6.7% with any reproductive toxicity data, not to mention with the vast majority not even having basic oral toxicology data, which is a shame given the fact that most of these chemicals are ingested orally. There was noted at that time an extensive use of the GRAS designation, and the limitations to FDA authority and procedures were also raised as reasons for this phenomenon to be in place for even a conservative subset of the aggregate chemicals that are used in foods, including indirect food additives, which are not mentioned here. So let's talk a little bit about the GRAS loophole. I've already mentioned that essentially it's a vouching process by industry. There's no opportunity or legal obligation for FDA or public to review. It was intended only for limited use, but over 1,000 chemicals are now essentially under GRAS, and there is well known to be extensive COI or conflict of interest in GRAS designations. In addition, the FDA has limited authority to reassess the safety of chemicals on the market. It doesn't consider cumulative or synergistic effects, and the toxicological testing methods themselves, even if they were done properly, are not sufficiently protective for children, in that there are not deep evaluations of endocrine or neurobehavioral endpoints, and the testing guidelines are not really appropriate in that they don't consider the variability of body weight and the fact that children pound for pound eat more food. So our recommendations at this point for parents and pediatricians were to provide safe and simple steps to reduce exposure to the chemicals of greatest concern, be it through avoiding microwaving food in plastics or beverages, avoiding putting plastics in the dishwasher, avoiding plastics with recycling codes 3, 6, and 7, the chemicals of greatest concern. Given that there are low-income populations that are a substantial proportion of the patient population, we had to be balanced in our consideration of the reality and practicability of consumption of fresh and frozen fruits and vegetables, and we encouraged washing of fruits and vegetables, recognizing that the evidence for reducing chemical contamination is more modest in that respect. The basis for these recommendations are based in relatively modest but important studies, including Ruth Ann Rudell's study documenting that a food substitution with fresh foods reduced BPA levels by 66% and DEHP metabolites by 53 to 56%. In addition, we also felt that the FDA should substantially revise the GRAS process. We recognize that in the current regulatory framework, there may be limitations to what Congress may actually do, even with the change in the leadership that's upcoming in January. In addition, we appreciated the need for improvements of safety guidelines and a variety of other things that the FDA could do without law. You can see in the lower 3 bullets that we do see a substantial place for congressional oversight and revision of FDUCA as well. Just a couple of quick comments for those who may be concerned about the costs of these kinds of interventions. A while back, we looked at the implications of taking bisphenol A out of baby bottles and sippy cups, and we saw this as instructive for the reality that not all of these interventions require substantial net costs to society. What we did was to examine the costs of BPA exposure for 2 outcomes, a subset of the entirety of bisphenol A relevant endpoints, childhood obesity and newly incident coronary heart disease. We found that the social costs of these exposures in 2008 was $3 billion. And then we ran a Gedenken experiment, which essentially modeled the counterfactual in which BPA was removed and substituted with a presumed, not certain, alternative free of hazards. We identified oleoresinous costing 2.2 cents a can. If you assume in the United States that 100 billion cans are produced annually, that's a cost to society of $2.2 billion. We then modeled the benefit in the counterfactual for those two outcomes and found benefits of $1.74 billion, which suggests a near but not net benefit to society, though sensitivity analyses suggested that the benefits could be as high as sixfold compared to the costs of BPA substitution. The reality, as I alluded to earlier, is that BPA is being replaced with SFPZ, you name it. I won't even go through the full list of the BPA whack-a-mole replacements. What we know about BPS is that it's similar in estrogenicity as toxic to embryos and doesn't degrade as easily in seawater, suggesting its environmental persistence may be even greater and suggesting longer latency to excretion in humans as well. So I'll just also close by emphasizing the costs of EDCs. We recognize that food packaging at present doesn't comprise the vast majority of these costs. We estimated 26 billion in euros annually of EDC-related costs for phthalates and bisphenol A, but that was a subset of the diseases known to be associated with those exposures, as well as an analysis of just a subset of food additive-related EDCs, and a subset of costs related to the diseases due to the subset of food-related EDCs. And in the United States, just to provide a similar analysis, our cost estimate was of $56 billion per year due to chemicals commonly found in identified as food additives. Again, recognizing that that's a subset of the total costs of those food additives, but still a substantial contributor to the aggregate costs of EDCs in the United States as well. So with that, I apologize, I've gone a little bit over time, but I'd be remiss if I didn't thank a large group of members of the executive committee, former executive committee members, all of whom contributed. And it's notable that there were liaisons contributing to this report from NIEHS, ACOG, EPA, the CDC, and NCI. And so with that, I also need to thank Paul Spire, who was the staff person who navigated us through this process, which was not always easy. So thank you, and I look forward to your questions.
Thanks a lot, Leo. This was very informative, and it sounds like it's actually highly improbable to get something like this published, listening to all the different committees that this report had to go through. So congratulations on that. And I would like to invite everyone to send us their questions by email if you have any questions. The email address is events@fp-forum.org. And maybe just to start us off, I can ask a few questions. I wrote quite a bit down. So, Leah, maybe to start with a difficult one.
Try me.
Yeah, you had a whole list of recommendations, what parents and pediatricians can do. And top of that list was prioritize consumption of fresh or frozen fruits and vegetables. Now, not everyone can afford that. And how do you deal with that in your sort of daily life as a pediatrician? I'm sure, you know, there's a whole area of sort of social injustice and so on, research going on, but maybe you can share with us how, you know, what the concerns are of everyday families in that respect. Is it an issue or isn't it?
Sure. So I would first say that I work at Bellevue Hospital, which is the major public hospital in our public hospital system across New York City. So I see this issue, I live this issue. I don't practice quite as frequently as I used to, but I recognize the challenges that come with this. And we always couch this kind of advice in the context of the socioeconomic and other built environment as well. Realities. There are some families who just can't even access the foods we're talking about due to physical location. And so these are conscious realities. There are disparities well known by socioeconomic status. and race ethnicity in exposures, at least in the United States, which speak to these kinds of phenomena. So I would say it's not easy, but if we don't inform and provide a balanced perspective, the issue will not ever get addressed.
Yeah.
So there are some people who would rather sweep this issue under the rug, and I'm not one of them.
Mm. Okay. Another question that I have is, you know, when it comes to many of the chronic or non-communicable diseases, for some of them at least, we hypothesize that they actually start doing fetal development, and that the sort of groundwork for those diseases developing later in life is laid then. Now you're a pediatrician, and the statement is from the American Association of Pediatricians. But how do you catch those fetal exposures, and maybe even to add on to that, as if that wasn't complex enough, what about pre-conception exposures of moms and dads?
Okay, so that's a great series of questions. And I would say the Academy's report is a great foundational step for collaboration with other non-governmental organization entities, such as the American College of Obstetricians and Gynecologists. As it turns out, there is a liaison between who stands on our American AAP panel on environmental health from ACOG. So we have that kind of connection already established and can work collaboratively. In addition, these kinds of documents allow broader NGO participation across the life course. Clearly, the kinds of solutions and decisions that this report speaks to require broad engagement of the entire population. I would agree with you fully that the kinds of exposures that we're talking about may be as problematic, if not more, preconceptually. And so that requires internists, obstetricians, and gynecologists, as well as urologists. I mean, you can go on in the list of providers who really should be involved but don't have the knowledge as yet. So we really do have our work cut out for us in this regard. So I see this as a foundation for a broader dialogue. Clearly, children are a great example of a population that prompts policy action, but it need not focus only there in terms of what it does for changing provider activity.
Mm-hmm. And so how do you see the next steps, like moving on from here? You mentioned we need to have more dialogue. We have to involve the different experts and the different stakeholders. But how do you and how does AAP envision doing that?
Well, we have a lot of work to do. There are a lot of other issues the Academy is dealing with. Most recently, if on the social media sphere, the discussions about things like gun control and other issues get a lot of play and competition. The fires, even in California of late, speak to the issues of climate change, even with our own community, within our own community, as a question of where to prioritize attention. Now, I would argue that those are different spheres of influence where one needs to act. One's more global, one's more local. But to really pivot to your question, the reality is that this document provides a talking point and is a pivot for our Academy Legislative Affairs as well as other entities to really rise up and speak up and do what some of us on the Academy might think already should have been done. But this document really puts it in cement and really starts the concrete dialogue. We've already seen outreach to the Endocrine Society as well as other organizations in the United States, and we can build out from there. We can build out to the internists, we can build out to others, and really think about preconception as a a particular focus, because I would agree with you. It needs science behind it, and we are behind in the science, and it's hard to do preconception science for a variety of reasons, but that doesn't mean that the exposures aren't important.
Yeah. Okay, well, I've got one last question, Leon, then I'll let you go. Maybe a little bit more technical about the report itself. You mentioned a group of different indirect food additives.
Yes.
Were these all the ones that you looked at? And if yes, how did you select these? What was the basis for selecting these chemicals? You mentioned 4 different groups.
These were selected by the authors based upon our interpretation of the state of the science. So I would say there are always issues with how you pick chemicals that are in or out of scope. I would argue we were as complete as we could, that we were really taking the totality of the scientific literature into account. My sense is that we were over, I think the final count of references was 200, if not more. And that's relatively large for such a document, but that only means so much. There's so much we don't know still about EDCs. Just to use that as an example, there are only 1,000 or so identified EDCs, but how many are excluded and how many of those comprise the 80,000, or if you use the more conservative 30,000 registered list through REACH, you're still maybe at 3% in the assessment rate of the effects, and I would posit that we're over 4,000 by minimum, just looking at the direct additives, and I anticipate, based on what we know in the literature, we're talking about 10 or 15,000. So even if we look at the universe of food additive chemicals, we only know about 5-6% of these, a single thing that's important. That speaks to profound gaps. So we were limited, and I would argue we didn't have the time to give justice to how focused we were at the tip of a proverbial iceberg.
Yeah. Okay, great. Well, congratulations on this very important work, Leo. And I just want to check if there are any other questions coming in. Not at this time. So I would like to thank everyone for participating in the webinar today. And most importantly, I'd like to thank you, Leo, for a great presentation. The next webinar will be held on the 26th of November. We have Dr. Melissa van Boshout, who's with Cienzano in Belgium and formerly worked at the Office of Public Health in Belgium. She will speak about a new publication on prioritization of potential genotoxicants in food contact materials. And at this occasion, we will also introduce our revised FPF dossier on NIAS, which are non-intentionally added substances. And the workshop, I also want to flag that already for those who like to plan ahead. Our annual workshop next year will be held on the 24th of October. So please save the date, and if you have suggestions for speakers or topics, then please let us know. And today's webinar will be made available on our website freely to download, and we'll also have the slides there. So thank you, everyone, and have a great day. Take care.